This episode is brought to you by HBO Max. The final season of the Emmy Award-winning series Hacks is now streaming. Starring Jean Smart and Hannah Einbinder, Season 5 finds comedy queen Deborah Vance returning to Las Vegas to solidify her legacy. Don't miss all new episodes of Hacks every Thursday at 9 p.m., exclusively on HBO Max. And listen to the official podcast on Spotify and HBO Max. Subscription required. Visit hbomax.com for details.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg. I'm your host of Yoga Birth Babies, and today we're going to talk about what partners get wrong and right about supporting birth. So my guest speaker is Yiska Obadia. She's an experienced doula, acupuncturist, perinatal bodyworker, and comforting touch for birth educator. She is also the leader of our class, Massage for Pregnancy and Birth. She's been facilitating that for several years at PYC. And if I'm correct, this is her third podcast with us. When I started to think about how partners often react to their role of showing up for birth, I thought Yiska would be the perfect person to speak to about this. Several students gave me the idea to go into this because there was a conversation before one of the classes about one student was lamenting that she really wanted her partner to be more engaged and involved, and she didn't quite know how to get him on board. Now, he seems like a great guy. It sounds like the issue was a bit of fear and apprehension about how does he show up in this role. So that's what sparked my idea. Let's do a whole podcast about that. Because if one student is sharing that experience, I bet there are many others that want their partner to be involved, or the partner wants to be involved. They just don't know how. So Yiska talks about a lot of stuff. We talk straight about how to get partners engaged in pregnancy and birth, and what does that even mean, like to show up. We talk about beyond just attending classes and reading the books, how can they prepare as a team? What kind of conversations should they have ahead of time? How to set expectations and boundaries around birth. And then also how not to take things personally if the person giving birth maybe gives a bit of a stink eye at times. It's not personal. So we really dive into how to help partners be engaged and involved in the pregnancy and birth process. I'm really excited for you to hear about this. Now, before we dive into my conversation with Yiska, I always love to give some updates about what's happening at Prenatal Yoga Center. Really, the best way to stay up to date is to get on our newsletter. So you can do that on our website, prenatalyogacenter.com. We talk about the latest podcasts. I always give a tip or something that's going to help, and a video. Maybe it's a different type of movement that we're doing in class. Just some wonderful piece of information to stay up to date and to help you during pregnancy and early parenthood. You can also check out what our class schedule is on the website. You can check out our in-person classes, our online classes, our on-demand classes. And then the last thing I'm going to share about some great info you can find on our website is our teacher training. So we lead it 4 times a year. We do it 3 times online and 1 time in person. And then coming up, we have our once a year online postnatal teacher training. It's something that has continued to evolve as PYC has evolved, and it's really a passion of mine. It is one of my greatest joys to help teachers bring this methodology to their community to help support the pregnant community. So I'm really excited and proud of it. So if you're a yoga teacher, check that out. And if you're a yoga practitioner and you're curious about where some of our PYC method teachers are around the world, we have a directory also on our website. You can find that out. 2 more little things before we get to my conversation with Yiska. I, as always, like to thank you, the listeners, and I also want to thank you for sharing your topics and ideas. I'm constantly getting emails of saying, have you thought about doing a podcast about weaning? Have you thought about doing a podcast about introducing a sibling? So many times it's your ideas that spark me to find an expert to cover that topic. So thank you for that. And then my big ask and favor for you is to please leave a rating and review of the podcast. It helps people find us. All right, I think that's enough for me. Let's take a quick break. When we come back, please enjoy my conversation with Yiska.
K-pop Demon Hunters Saja Boy's breakfast meal and Huntrix meal have just dropped at McDonald's. They're calling this a battle for the fans. What do you say to that, Rumi?
It's not a battle. So glad the Saja Boys could take breakfast and give our meal the rest of the day.
It is an honor to share.
No, it's our honor.
It is our larger honor.
No, really. Stop.
You can really feel the respect in this battle. Pick a meal to pick a side.
Ba-da-ba-ba-ba.
At participating McDonald's while supplies last.
Hi, Yiska. How are you?
Hi, I'm good. Happy to be here.
I know. As we were talking before we pressed record, I can't believe this is your third podcast with me. I guess when I find someone that I think is a great speaker, but then also has really good information, I just keep going back. It's like ordering the same dish at your favorite restaurant. Well, I'm excited to dig into your background as a doula, as a bodyworker, and all the different birth modalities that you dig into, and talk about something I hear my students stress out about, which is how to get the partner involved. Some students share their partners like really involved. They're at every appointment. They're super involved. And then others are kind of scared. And then others just don't know what to do. So thank you for letting me pick your brain and then help the community get their partner involved. So thank you.
I love that.
All right. So let's jump in case people haven't heard you on the other podcasts. Why don't you share a little bit about yourself and what led you to doula work and all the other birth modalities you're involved in?
Sure, yeah. So I originally started out as a massage therapist for a bunch of years before I ever knew anything about birth or doula work. And that's, though, how I got to my first birth. A friend of mine invited me to come because she knew I did massage and she felt like she would really want a lot of touch in her labor. And, you know, when I got to that birth, and indeed she did, she wanted a lot of touch. And I was just like blown away by the birth experience. I was like, you're kidding me that this is like a career path. I had no idea. And I kind of went from there, signed up for my first doula training. And that was kind of the beginning of that. And because I was then working in birth, I started to see more expectant parents for body work and acupuncture, and it all kind of just wove really well together. But I was also thinking about how I think the reason it touched me so deeply to be in this role of birth support goes actually back to my mother's birth with me. She basically had no support. So she, you know, doulas weren't really a thing back then. And from, you know, in the main culture, I'm not 100% sure what it was like for all families and all couples, but certainly the culture that my father came from, the men were not in the birth room. And so he was in the waiting room, not around really, and she really was alone. And I feel like a lot of the things that she experienced would have been different had she had support, had she had her, you know, partner there, my father there, and any kind of support person as well. So I think that that's like the deeper call to this work goes all the way back to that.
That is really fascinating. I actually often say that our births, like not necessarily the ones that we give birth, but like our own births from our parents have a huge impact because we often hear the stories, and whether we realize it or not, it's how we start to have a view of birth. And so while I'm so focused on helping parents have a positive birth, kind of pass down that positive image. So it's really fascinating. You're bringing it back to that. So thank you for sharing that.
Yeah.
All right. So let's jump into partners getting involved in pregnancy and birth. So when we talk about partners getting engaged in pregnancy and birth, what does that actually mean besides just showing up?
Yeah. Well, I mean, I think that the things that resonate for different couples and partners will be different, but I think the primary piece is some kind of preparation and education and conversation around what they're about to step into together. And and so there are books, like, for instance, there's a book called The Birth Partner by Penny Simkin, and it's a great read. But for instance, if your partner doesn't like to read, or nowadays we have the option of like doing listening to it. But, maybe that's not the way that your partner is going to best, join you in the conversation. For sure, some kind of childbirth class, I think, is essential. And then in general, obviously, I'm super biased towards this, but, hiring a doula so that you have somebody helping to facilitate having the preparatory conversations so that you can show up fully with some foresight of what you could expect, even in part knowing that you totally can't know what to expect and how to pivot together in partnership, feeling connected with each other as partners, as opposed to disconnected, or as opposed to feeling totally blindsided. And, in terms of other ways of gathering information and preparing, like, this is a perfect example. Like, podcasts, I think, are amazing. Not everybody listens to podcasts, but if, your partner's really into listening to podcasts and, so there's no one right way to prepare, but thinking about immersing yourselves in learning about what to expect, and then hopefully having the help of a doula or some help to have some conversation leading up to birth, I think sets people up for success, to be like really grounded together.
I like that you brought up the doula, because back in the days when I was an active doula, sometimes the partners thought from our first initial kind of meet and greet that the doula is going to take their place. And one thing I tried to explain is, like, I'm actually here to help you be the best partner you want to be. Yeah. Because a lot of the parents I was supporting, this was their first birth. Maybe it was their second, but that means they've had either one or zero experience, but the doula has more. And so I explained, I can point things out that maybe you didn't realize you can help with, or normalize what's happening in pregnancy or birth, because a lot of fear of the unknown can show up. So I love that you brought up a doula, because it's not a replacement. It's actually, I think, something that adds to the partner being able to be a support. And I also love that you brought up the discussion and listening, because I think that's one thing also that I know my husband and I have these conversations. I'm like, I'm not asking you to solve my problems. I'm just asking you to listen.
Yeah.
I think that can be a way of also being engaged in pregnancy and birth, just to listen about it.
Totally.
All right. So from your work, what do you think partners most commonly misunderstand about their role during pregnancy and labor?
I think maybe this is one thing, that things that are helpful or ways that you operate outside of labor are going to work the same way inside of labor. So, like, for instance, if part of how, you break ice or feel comfortable in unfamiliar situations is to, like, be funny and, create distraction, and, like, that might be great. And that might actually also have a place in the context of birth and during labor, but also knowing and learning about how that there are going to be times where, like, that's not going to be wanted, and that also goes for anything. Like, if your love language is touch as a partner, or your love language is, words of affirmation, or, I don't remember all the love languages, but the idea being that, like, if that's your go-to, oftentimes those things are going to be great because that's part of what your partner loves about you. And other times it's just not going to be the thing that's supportive in a particular moment, especially like during the intensity of contractions. Those things may not be as welcome as they might
like
be.
Humor.
Like humor, exactly. You see those videos of people giving like the stink eye to their partner because it's like, not the time.
Read the room.
Right. And then also, though, the flip side of that is how to not take the rejection of that personally, because it's not personal. It's really about what your partner, the birthing partner, is needing in the moment. Oftentimes that's about what's going on internally in their bodies and has nothing to do with you doing something right or not doing something right. So I think that is something that can come up. And I also think that there is something to looking at the things that are helpful for your partner, like the things that do and don't work, like when they are, let's say, sick, or when they are, you've been through a challenging hike. So I do think that there is some information to be gathered about what could be helpful for your partner in terms of support from those other life experiences. And also, like, nothing is like birth and like labor. And so it's really worth learning about what to expect just broadly from the experience, and then have conversations about what that looks like uniquely in your partnership, in your relationship, given who you each are as individuals.
That makes a lot of sense. Yeah, I remember working with a couple, and we did this thing, the 1 minute ice cube test. I'm sure you've heard that, the Lamaze thing. And I had them do it, and because it's uncomfortable, and I wanted the partner to see what his wife was like uncomfortable. And it made me, the reason this came up is like the humor. He was like kind of joking with her and gave her the stink eye. And then after that, we had a little debriefing of, so how did that work? He's like, yeah, she didn't seem happy. And she's like, don't talk like that. Just don't. And so it gave him the opportunity to recognize, I think it was nervous anxiety, because he saw she was uncomfortable, didn't know how to step in and help and diffuse the situation. Probably, like you said, go to your common banter back and forth. And it gave her an opportunity to be like, yeah, that's not going to work. And so from that, they were able to figure out when she's uncomfortable, what actually is helpful. You mentioned attending classes, reading books, listening to podcasts, and learning. Why does preparing as a team matter so much rather than one partner taking the lead, learning everything, and then just kind of spewing at the other partner?
I mean, I almost think anyone listening can answer that question for themselves, but like pretty much even the way you put it, like who wants to be spewed at, right? Like, and even if you're thoughtful about it, I think it's much easier to take ownership of something and integrate information and feel like solid and grounded in something when you feel like you're an active participant in that.
But if the partner doesn't want to read the book or listen to the podcast, what is a way to help bridge that information gap?
I mean, it's interesting. I totally bumped up against like the not getting the partner to read the book or, but I think that at the very least being willing to attend a birth class together is really important. And I haven't met couples that wanted their partner to be involved in some way and to prepare for birth together, where they weren't willing to at least come and do that. Yeah, that's an interesting question to consider.
Have you ever, as a doula, and this is maybe just totally from your own background, have you ever been in a situation where the partner was really checked out and you were trying to bring them in? I have one that popped into my mind. I'm curious
how you've dealt with that.
Yeah, I mean, I've definitely had partners who were, and I think this is part of the importance of these preliminary conversations, whether the conversation happens between the partners for clarity purposes or even with, the birthing person and their doula, to understand together how to navigate sort of the, if that support isn't going to be present in a certain way. So for instance, like I've definitely had clients who were like, I know myself, like the partner's like, I'm not going to want to be hands-on, and I'm not going to, I'm kind of freaked. I don't really want to see the blood. I'm kind of freaked out by those kinds of things. And so even though just being able to talk about that in advance, is helpful, because then that can help to calibrate the expectation of the birthing person. And then it's also about finding, well, then how do you want to be in there? Right? Because like assuming that they will be there at all, it's like we're going to look for how you can be there in a way that feels like meaningful and useful for the process. Right? So, it oftentimes, like in that situation, the one that didn't want to be hands-on, they were willing to, go get ice chips and go get, water when we needed it, or be in charge of the go bag, the snack bag, or different kinds of things like that, So I feel like there's always some way for a partner to be involved in a way that works for who they are. And I feel like the biggest piece is managing the expectations so that everyone knows in advance kind of what to expect. And then there isn't, disappointment.
So I really like how the bottom line is really expectations about expectations for the partner. So understanding, okay, maybe some partners can show up and they really want to be hands-on. And then some partners, like you said, are freaked out from the blood and you're giving them tasks. So do you think there are some kind of standard questions that you think partners should, or couples should have before to kind of lay out what those expectations are?
Yeah, I mean, I think a broad conversation around like, what do you imagine your role being in this? And it's certainly, easier to answer some of these things after a childbirth class, to understand some of all the different things that can come up in the course of birth. But yeah, just speaking explicitly about, each person kind of answering, what are you imagining, my role being as, the person giving birth? And then, what are you imagining your role being as the supportive partner? And, are there, asking questions around, are there any things that you're concerned about or worried about, being able to show up for, or, that like you really don't want to, for instance, like see where, when the baby is crowning, so where will you be in that moment when, I'm pushing and the baby is coming, what will be a good place for you to be so that need that you have to not be seeing something you don't want to see is honored, as well as me feeling your presence and support, which we also want to have, so kind of talking about the different scenarios and just imagining, just talking about what those roles are and what the concerns are, and exploring what might be potential triggers, so that, whether it's somebody knows because of a prior trauma that there's a preference that they have about how they interact with their care provider during labor, or even the partner having, prior trauma that might make them more susceptible to being concerned or anxious around certain things happening, so that, as a supportive partner, they can feel good and grounded.
I actually want to dive into that a little bit more. We're going to take a break. When we come back, let's dive into the partner's experience a little bit more. All right, so we're going to take a break. We'll be right back.
REI has ultralight backpacking gear. So for you gram counters and ounce shavers, we made this ad ultralight with a base weight of just 13 seconds. The next 17 seconds, pure trail. Find more with less in-store and at rei.com.
Tomorrow morning is knocking. Stock your fridge now. How about a creamy mocha frappuccino drink? Or a sweet vanilla? Smooth caramel maybe? Or a white chocolate mocha? Whichever you choose, delicious coffee awaits. Find Starbucks Frappuccino drinks wherever you buy your groceries.
Okay, we are back, and I'm really glad that you brought up the partner and triggers, because I had seen that only a couple times where the partner knew, one time the partner knew there was going to be a trigger and removed themselves. And then one time it was kind of came out of nowhere. So you've talked about being aware about partners being in the experience. Have you seen also situations, because I mentioned I just have seen that, where partners' fears, past experiences, traumas triggered, show up in unexpected ways, and then how have you helped shift that so that the support can go back to the birthing person? I know I just threw a lot at you.
No, I get it. No, I hear it. And I can answer that first with like some kind of more mundane and common things that happen, so I wouldn't necessarily call them unexpected. But, for instance, sometimes people, partners don't realize like how hard it might be to see their partner experiencing pain, and knowing that they their job is not to rescue them, it's to, help them feel safe and held and loved, and honor their preferences if they change with regard to pain medication or not pain medication. And so, I remember being in a birth where the person had intended to not have an epidural, and we had talked about it in advance, but in the moment, her partner, he was having a really hard time, being with how she was feeling. And she was managing actually really, really well, but he had never experienced that. I knew she was doing great, and she was just breathing through what she was experiencing and vocalizing around what she was experiencing and didn't really need anything other than to be held, and he went to say something about suggesting an epidural, which was something that we had clearly kind of discussed in advance about, if she's going to want an epidural, that will come from her. And he was so tempted. And I was no, I signaled to him, don't say anything about it. I know, so we kind of it was a little bit nonverbal, but also validating the fact that he was feeling overwhelmed by the experience she was having, while also remembering and reminding him she's really okay.
That is so simple. That's so great that you said that, because the situation I had was similar. And hearing that, I'm wow, that is, that's good to know. This is kind of a common thing. So the client I had, the partner also wanted to, the birthing person did not want an epidural at the time and made it clear. And the partner knew that. But upon seeing her work through it and the sounds, I think the sounds of she was making kind of those low guttural sounds might have freaked him out. But he kept saying, I think you're hurting the baby. I think this is hurting the baby. Oh. And, talk about fear. That creates fear. So the way that I tried to help diffuse the situation is I had the nurse, and honestly, the doctor didn't come in that much, but I had the nurse, and then finally when the doctor did come in, say this is what labor looks like. She's doing great. The baby's doing great. Mm-hmm. So I had to help his anxiety and fear, because it wasn't helping that he was coming at her saying, I think you're hurting the baby. But I appreciate you sharing your story, because it's not that different than the story I experienced. And then our listeners realizing that might come up. So maybe that's part of the conversation ahead of time of okay, these are the sounds of labor. This is, if you're unmedicated, these are the sounds of labor. This is what I might look like. This is how I might move. And it's totally normal.
Totally. Also, I actually didn't have this experience firsthand, but a doula friend of mine recently shared this experience that she was backing up. And so she had not had prior conversations with the supportive partner in advance. But one of the things that was going on in the labor was that he had had a lot of medical trauma history. And so he was going in there feeling very antagonistic towards the staff, and the beeping of the machines was really triggering for him. And I mean, it was work onable in the moment. They ended up having a really wonderful birth, she said. But, for a period of time until he could regulate, until the doula helped him, kind of translate things in a way that were more present moment than activating of his past and his history. It took time to do that. So I think that if someone knows that they have anything like that in their history, I think talking about it is really helpful. But I also think, whether it's the person who's pregnant or the partner, bringing those things to some kind of therapy that can help process those things is really valuable if you can do it in advance. And if you can't do it in advance, or for whatever reason you don't want to do it in advance, for everyone on the team to be aware of it at least.
I really like that. All right. So it's kind of recapping a couple things about conversations, because I think all this really goes back to the talk before the birth. So setting expectations, talking about the kind of support that the partner can give and that the person wants. But I want to throw one out there that I'm hearing about what you're saying, and kind of what the person I saw supporting: triggers and fears, thinking about that ahead of time and having that, really thinking about it instead of being like, oh no, I'm fine. Everything's fine. Be like, how are you? Let's look into our past and really look in, dig into the skeletons a little bit, because things come up. It's such a high emotional time, and sometimes sleep deprived, that things that we might have not even thought about, like you said, the person had a lot of medical background, a lot of stuff from their background that was medical and maybe overwhelming. So I like that the listeners can have a little bit of a list that they could start to think about. Let's talk about how partners can advocate and stay involved without taking over or unintentionally overriding the birthing person.
Yeah. So, I do think in some ways, some of the foundation of that is going to go back to the getting clear in advance and having conversations in advance, knowing what matters to you guys as a couple in your partnership, what you want for the birth, what you want for the baby. And, knowing things that might be triggering or really, really important to your partner, so that if it's in a moment when they're not able to be available to speak clearly, that you can advocate and speak on their behalf. And I feel very fortunate. I've been mostly with clients and partners who are very respectful of their partner's autonomy and respectful of their decisions with regard to things that are happening in their bodies. But I feel like one of the most important pieces, I feel like this comes up in probably almost every interview, or at least any interview with a doula, is the whole brain concept. Mm-hmm. That it's a really helpful.
Explain that for those that are like, what does she mean by brain?
Yeah, sure. So it's basically as things are coming up, as choice points come up to you as a couple in the experience, and there are choices to be made, to know that, unless it's an emergency, which is so rare, usually there's time. And if you want to ever check with your care provider, is there time for us to take space as a couple and talk about this and think about things? Or is there time, can you explain to us basically what the BRAIN acronym stands for, which is B for what are the benefits of this choice point that we're at? What are the R, the risks? That's the R of the brain. What are the risks of this, making this choice or not making this choice? The A standing for what are alternatives? Are there other things other than the first thing that you've mentioned to us as an option? then the I standing for intuition, is, the laboring person, or, having some kind of gut sense about what might be the right thing to do. And the N standing for nothing, like doing nothing. And so I think that having that as a tool when it comes to choice points that can come up, and knowing that you have time, that together you can talk about these things. Again, maybe not during, it's different if someone has an epidural versus if they don't have an epidural. With an epidural, there's going to be like more space and availability to being able to have conversations with your partner about things and, discuss if things have changed or how you want to interact with this particular choice, whether it's having a new medication or having something happen now that you had thought maybe wouldn't be on your list of preferences. Or, if you're in active labor and what you have is the space in between contractions, knowing that that's going to be the place that you can talk and connect with your partner around what you want to do, and that it can be a shared decision-making process between you as a couple and the care providers who may have information that you don't as well.
If you can offer partners one mindset shift going into birth, what would that be?
Just one? How do I pick the one? I feel like, and this is true for everyone in this process, to take the pressure off of some imagined what it looks like to do everything all perfectly right all the time. That's not really what's needed. What's needed is being willing to be responsive to your partner's changing needs. And that's it. And that for the most part, you really can trust that you know how to love them, and that will work a lot of the time. And that all you need to do is just learn a little bit about what to expect about the birth and labor process, so that you can know like how to modify your automatic way when it might not serve in the process.
Oh, I really love that. I really appreciate it, especially kind of taking the cues from that person,
Yes.
like from the birthing person. I think that's really important, because sometimes people can go and be like, these are the things I'm going to do. And then that's not actually what the birthing person needs. So kind of like watching and listening and taking the cues. Oh, I absolutely love that. That's really good advice. All right. We're going to take a break, our last break. When we come back, what is one final tip or piece of advice you'd like to offer new and expectant parents? We will be right back.
Good sleep is everything. That's why Ollie's Science Bag Support is made with a blend of melatonin and L-theanine for both kiddos and grown-ups. So when your mind won't switch off, you've got something that can help. Your racing thoughts and restless nights won't stand a chance. Find Ollie sleep solutions for the whole family at ollie.com. That's OLLY.com.
So we are back. Now, this can come from anything. You're a doula, you are a massage therapist, an acupuncturist, you teach your comforting touch. You've worked with hundreds of new parents and expectant parents. I'm curious, what is the one final tip you want to leave us with?
I mean, it's funny because I think that I said this very thing the last time. Okay. Like, it really comes back to hiring a doula. Like, so I feel like the mindset shift that I said is the more like mental and emotional, like, reframe for how to hold everything. But at the end of the day, I think that the doula is this person that can help bridge the gaps that are there between, the birth education classes and how to take that information in and apply it to your own unique relationship and dynamic between you guys as a team and your care providers, And so I just feel like doulas are such an important resource to have because all the things that are helpful are usually available in the working relationship with a doula. Whether that's accessing information or resources or other useful mindset shifts that are applicable and valuable in the particular moment.
Oh, I love that. Yeah, I'm a little pro doula if you haven't figured that out.
Obviously, I'm biased, so.
I'm a little biased, a little pro doula there. Yeah, as I said at the beginning of this conversation, a doula is not taking the place of a partner. They can really help the partner shine. They can take the pressure off of not knowing what they don't know because how were they supposed to know? That's a great thing. So where can people find your work besides our website at prenatalyogacenter.com?
Yes, I'm coming to the massage techniques for pregnancy and birth class. So obviously there, but I have a website. That's my name, yiskaobadia.com. And I'm also on Instagram at Comforting Touch Doula. And I think that I'm very excited to share if anyone is interested in staying connected with regard to the launch of our Wisdom of Birth Tarot and Oracle deck. If people sign up for either follow me on Instagram or through my website, you will stay in the know with regard to that. And I had meant to mention it at the start of the call because I actually pulled a card from the deck leading up to this call being like, what's the most supportive concept, or energy to bring to this call? And I pulled the partnership card.
Oh, I love that.
I know. I was like, that's exactly the energy of what we're doing here.
And for those that go to Yiska's website, you can sign up for her newsletter, which I get and read. And you always have interesting stuff in your newsletter. So I appreciate that. Thank you. Yiska, it's always so much fun to connect with you. I just adore you and I love all you bring. So thank you.
Thank you.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.
Struggling with weight loss? Prolon's 5-day fasting mimicking diet is a clinically developed nutrition program designed to promote fat loss while protecting lean body mass. Developed at USC's Longevity Institute, it assists the body in entering a fasting-like state that helps reset metabolism and target visceral fat. In just 5 days, Prolon offers a science-backed approach to weight loss without extreme restriction or guesswork. Get 15% off plus a $40 bonus gift when you subscribe at prolonlife.com/now.